The next issue that we are going to talk about is the relationship of your shoulder to autoimmune response. Now, what is autoimmune? Autoimmune means that your own body's immune system is attacking your own shoulder. It could be attacking the shoulder muscle, it could be attacking the tendons, the ligament, the bursas, the disc, the bones. If there is autoimmune issue, no matter what you do, no matter whatever treatment you do, you're not going to get better. You're not. Okay, so autoimmune is very important. We got to find that out. If you have autoimmune, you tend to have very chronic. You had the problem for a very, very long time. It could be 10, 15 years, or it could be 1 or 2 years as well too. Okay, the only way to find out if there is autoimmune issue is whether by blood test, or sometimes the pulse test that I do for patients can also detect that as well too. Okay, so every time when we detect if there's any autoimmune issue in response to the blood test, then we have patients do a IgG or IgE testing, or we do the blood in such as white blood cell, red blood cell. We do basophil, eosinophil, neutrophil. That's different type of white blood cell. We also would do phagocyte, monocytes, mast cell, macrophages, and we also test for T and B lymphocytes, cytoplasm, cytokinin, interleukin 1 and 2, T helper cell 1 or T helper cell 2. All these, the list here, it's very important that you get this tested. If there is autoimmune issue, you have to take care of it. Now, if there is autoimmune issue, a lot of time, the body will be filled with bacteria. Your shoulder, your muscle and tendon, ligament, sometimes they're filled with bacteria, filled with viruses, or fungus, or molds, or parasites. If you have those kind of autoimmune issue, those immune germ issue, then you gotta take care of it. Okay. Now, and other than the blood test, there's another way we call a live blood test, which I'll explain to you in detail later on. You'll do a drop of blood, and we see the blood in the microscope, and therefore we can see a lot of different kind of germs in your blood as well too. Okay. Again, if you have bacteria, virus, fungus, or parasite affecting the shoulder, causing the shoulder not to get better, then we have to give you some supplements, some herbs to kill those bacteria or viruses. Okay. The next topic we're going to talk about is pH. Again, when your shoulder, when your joint or joint capsule, when the acidity of the shoulder joint are way high, when it's too acid. When it is too acid, it causes a tremendous amount of pain. If there is a lot of acidity, then we would tell patients to either use alkaline water or use lemon. Both of them would kind of decrease the acidity of your shoulder. The acidity could be tested by if you put a pH strip into a mouth, or you do a pH strip in urination. You can tell if your body is more toward acidic side or toward more alkaline side. Okay, there is a picture I want you to see. Okay, now if you look at the picture here, anything more acidic, it's going toward either 1.5, or -3. Gastric acid, battery acid, those are all very, very acidic. Okay. Coca-Cola, vinegar are very acidic. Now, basic alkaline such as household lye, bleach, salt water, intestinal juice, blood, they're more alkaline. Okay. Now let's read the statement here. When your pH is out of normal range, all sorts of bad things happen. For one thing, disease-producing organisms thrive. This explains why some people exposed to certain bacteria or viruses get sick while others do not. Acidic conditions can cause muscle to constrict and inhibit the exchange of nutrients and waste product in muscle cells, causing fatigue, soreness, and pain. In fact, a pH imbalance affects all cellular activity in the body and can lead to a wide range of disease and symptoms. Okay. Another big issue in regards to chronic shoulder pain is the nutrition deficiency. Just by pulsing or sometimes by blood testing, we can tell if your muscle is missing certain nutrient, if the ligament is missing nutrient, if the tendons, the bones, the joint capsule, if the fascia around the shoulder are missing certain nutrient. If the nutrients are missing, then your shoulder is more prone for injury, more prone to tear, more prone to spasm, more prone to weaknesses, okay, and also more prone to your joint get misplaced as well too. So we gotta give nutrient. The body needs nutrient. These nutrients such as vitamin A to Z, could be found in the multivitamin, or sometimes specific vitamins such as vitamin C or vitamin D. Very, very important to this structure of the shoulders. And minerals as well. Minerals such as you can find very, very rich mineral in seaweed, alfalfa plants, and eat those and mineral to replenish the nutrient in the muscles. Now, amino acid is one of the biggest missing nutrient in people, because a lot of patients when they come in, they are either vegetarian or they don't eat meat that much. People that does not eat meat, vegetarian, usually do not get enough amino acid. Therefore, they get a lot more damage to their muscles. They get a lot more injury when they fall, when they lift something heavy. Okay, so it's a very important issue. I always stress that to every single patient. Nutrient. Gotta have nutrient in order to repair. Gotta have nutrient in order for you to stay off pain. Once pain is gone, once you're repaired, the nutrient will maintain you basically. Okay. Now there are also another issue of the pain causing chronic pain is the relationship of the organ in relation to the shoulder. Okay, the stresses in the organ. Now, for example, patients that tend to get fearful, they're very fearful of maybe their husband and wife, fearful of money issue, fearful of government, fearful of jobs. People who fears more, the fear has a relationship with the shoulder according to the Chinese medicine. I'm sorry, to the kidney. Now, if the kidney is weak and you have a lot of fear, sometimes this emotion will get to the shoulder. This stress will build up in the shoulder, built up in either in the muscle, in the joint or joint capsule, whichever it is. If you do not take away the stored stress, the emotion in the shoulder, sometimes the shoulder will never ever get better. Never. Okay, I've treated tons of these kind of stress, emotion related pain to the shoulder, either the shoulder, neck, body, fingers, headache. Once the emotion is gone, once the stress level is gone, the pain sometimes is most time it's instant. Instantly they can raise their hand up. Instantly. Not everybody, some patient, but we gotta look at this factor. Okay, so different organs. Let me show you the picture. Different organs shows different emotion. So, emotion of the liver is anger. Emotion of the heart is hate, overjoy, impatience. Emotion of the stomach or spleen is anxiety, worry. Emotion of the lung, large intestine is it's grief. Okay, emotion of the kidney is fear. Okay, so like I said, the Chinese pulse will tell me which organ have issue and which organ has emotion, and we gotta deal with that. Okay. Now we're going to talk about different organ, how organ affects the shoulder. Not just the emotion, but the organ in itself. There is refer pain. I'm not sure if you heard of it. If you have kidney issue, if there is any kidney issue, then you might have back pain. If you have heart issue, the pain refers to the shoulders. Okay, so stuff like that. So we got to look at the organ to make sure every single organs of your body are healthy in order for your shoulder to become very healthy as well too. Okay. Circulation, lymphatic system, it's a huge thing. There's a big difference. Let me show you. Most of the time, people do not know what lymphatic system is. Okay, it's a difference. Now, if you look at this is the blood system, circulation. There's artery, there's vein, it circulates all over the body. Likewise, the lymphatic system. Lymphatic system also all over the body. Lymphatic system is responsible for draining off unnecessary toxin, unnecessary inflammation, unnecessary junks from your organs, from your muscles, from your tendons, from your brain. I mean, every single structure in the body, in the cell that has junks, that has garbage, the lymphatic system just draining it away, draining it off. If your lymphatic system is not working, if your blood system is not working, it will not carry off garbages. And the toxicity, the garbage is going to stay in your blood, in your system, in your muscle, in your tendons, your organs. It's going to cause major damage. It's going to cause major issue. You're not going to recover, first of all, most likely, and the treatment is not going to be useful. Any kind of treatment. Medication is even make it worse because medication is full of toxicity. Medication just made from chemical, they are so harmful to the body. It adds more weight to the lymphatic system, adds more weight to your circulation. Okay, and of course, if you have that kind of issue, then there's a way. There's a machine to help you drain the lymphatic system, help you drain the blood circulation. There's supplement, there's herbs. It's very easy to handle these kind of situations. Very easy. Okay. The next item, the next topic is going to be inflammation, food, diet. Every single time patient comes for treatment, every single patient will ask me, what should they eat? How do they eat? And every time when a patient comes in to see me, I will give them a list that they can or cannot eat. This list is not really for everybody. But generally, when you have a lot of inflammation in your muscle, tendon, ligament, or joints, you gotta have to avoid certain food, such as sugar, which we talked about before. Okay, wheat, gluten. Okay, you gotta avoid nightshade. That is one of the major food that will cause inflammation, that will cause joint pain, and almost nobody knows about that. Almost none of the doctor. And once you start avoiding this kind of diet, your pain sometimes just goes away by itself. Sometimes it's reduced by maybe 20-30% just by avoiding the diet. Okay, so I want you to. What is nightshade? You should Google it yourself. Really, let me show you here. Now, nightshade vegetables such as it could be, potatoes, tomatoes, yams. It says here pepper, red pepper, yellow pepper, chili pepper, cayenne, tomatoes, eggplant, paprika, all these. And you should read this yourself. Pause it and read this. It will give you a very good explanation of what nightshade is and how it affects your body as well too. Okay. All right. Next item. Now, the next item we are going to talk about structures. Now, another issue of shoulder pain, it really is coming from the neck. If you have a compression of the neck nerve here, now the compression will cause shooting pain down to your shoulder, also down to your arms or hands. Okay, if you have that kind of transferring or referral pain, then we have to treat the neck. Or sometimes the pain is not coming from the neck, sometimes it's coming from the ribs. Then we gotta fix the ribs. In fact, we gotta fix the muscle here. Let me show you the films here. The slides here. Okay. Now, if you look at these, shoulder pain could be caused from the neck. Sometimes could be caused by the herniated disc that might have compressed on the nerve and causing shooting pain down here. If you look at the anatomy, all the nerve of the shoulder and the arm, the hand originate from the neck right over here. Okay, different nerve compression will cause different area of pain, either the shoulder or the arms. All right. Now, all these could be easily determined if you come Every single time patient come in for the first time, I always offer free consultation. It's always a free consultation again. Come in, I determine what's going on for you, and you decide if you want to get treatment or not. Okay? All right. Now, another big issue in regard to the muscle pain, the shoulder pain, the chronic pain is your brain. Now, most people do not know, most doctors do not have this kind of knowledge. But just think about this. What moves the shoulder? I always ask patients that, and they always answer me, it is the brain that moves the arm, the shoulder, right? It is not the muscle by itself, because the brain sends down the message down to the muscle. The brain sends down message to the tendons and ligaments. So you can start move this way or that way or that way. So if the pathway of the brain is blocked, then the activity of the muscle is greatly diminished. So we gotta activate the brain. And there are ways of which I will show you later on. If there is a brain issue, how we go about treat it, how we go about detecting the brain if there's an issue, okay, and how we go about solving this issue. We're going to talk about all that later on in the slides as well too, in the treatment method. Okay. Again, the food allergy, when patients have issue with shoulder pain, no corn, no soy, no wheat, no dairy. This is the basic one. Basic. Avoid all these first. But again, everybody's different. I got a test to see which one is that you cannot eat. Okay. Now, if you do have an allergy issue, and of course, we offer a blood test. Not here, but we write you a prescription to get the blood test done. And there is a panel we call a California Allergy Panel, which you test it. It will test the entire body of your IgG, your IgE, your immune system. Also, will test what kind of food you're allergic to. Are you allergic to corn? Are you allergic to soy? Are you allergic to wheat? Are you allergic to wheat? Are you allergic to grass? Are you allergic to pollen? Every single allergic reaction most likely will affect the shoulder as well too. Okay, most likely will affect the shoulder. So I always encourage patients to get that kind of blood test done. Okay. And there is a matter of the Chinese philosophy. I will be talking about the pulsing, how I go about pulsing, and every single acupuncturist or Chinese Oriental doctor always pulse and always determine the body in terms of 5 different elements such as the heat, the cold, the wind, the damp, the fluid, the blood clotting, and all that issue. Okay. Yes, good. Okay, there's another issue with the shoulder, which is the gene coding, the methylation. If you have bad genes coming from your parents, sometimes you do. Sometimes the gene is bad, so that's why you cannot repair. Okay, sometimes the gene is bad, so your immune system goes bad. Okay, there is also a way to test genetics as well too. Okay.